Lord, you are the fountain of life, restorer of my soul. I worship you today. Lord, you are the fountain of life, restorer of my soul. I worship you today. Lord, you are the fountain of life, restorer of my soul. Worship you today. Lord, you are the fountain of life. You restore my soul. I lift my hands to worship you today. Oh, Lord, yeah. I am the well of life. Come to me, you thirsty soul, and drink, for there's peace, there's joy, and there's hope for the weary soul. Lord, you are the builder of my soul.
Hello everyone, this is Charles Zuta, and I welcome you to today's episode of the Fountain of Life podcast. It's a real privilege to be coming your way with this episode, even as we continue our discussion on escaping the anxiety trap, how to worry less and care more. Today is a really wonderful time for us because we'll have the opportunity to explore a few more things or tools that we have that will help us to avoid falling into the trap of anxiety. Just as a quick recap, I want to remind us that whatever information we share in this episode is purely for informational purposes and is not meant for diagnosing or treating any specific medical condition. And if for some reason we touched on an area where you think the information is applicable to you, I will recommend that you call 911 or perhaps you book an appointment with primary care provider to seek medical help. So thank you so much, everyone, for joining us. And I'm really excited to be hosting a special guest today who is a person associated with our ministry for so many years, and I've known her over these years. So it's a real privilege to sit down with her and have this conversation about how worry and anxiety impacts our health. In 3 John 2, the Bible says, "Beloved, I pray that you may prosper in all things and be in health, just as yours prospers." So John here is not praying for healing. He's not praying for God's divine intervention in this person's life, but he's praying that the person be in health. That is maintaining your health, staying in a place of continuous health. So that is a very good thing. Healing is one thing. Being healthy and maintaining health is also something that God desires for us. So today we want to look at how or the things that we should do to help us to stay healthy and help us to have a life that is full and is blossoming and it's supporting the things that God wants us to do as believers. So to join us today, I'm privileged to have Dr. Dorothea Addo, who is a board-certified internal medicine specialist. Dr. Addo is a product of the University of Ghana Medical School and also did residency at the Johns Hopkins Good Samaritan Hospital program in Baltimore, Maryland. After that, she moved to Fort Wayne, Indiana, where she has worked with a private health system for more than 24 years in their outpatient clinic. She's also a member of the American Medical Association and American College of Physicians, and she's active in community engagement as a member of the African American Health Alliance. So thank you so much, Dr. Dorothea Addo, for joining us today, and welcome to the Fountain of Life podcast.
Thank you, Reverend Zuta. It's a pleasure to be on this program with you. Thank you. Thank you.
So, as our topic implies, we are looking at escaping the anxiety trap, how we worry less and care more. And obviously, we are aware that worrying is not a good thing. That is the premise we are starting from. Of course, there are some good sides to it. So I'm going to defer to your opinion completely in this session and hear you out as you walk us through how worry and anxiety impacts our health. So basically, why is excessive worrying bad for our health? And how does worrying affect our health?
I'll start off by giving the definition of worry, as the last week presenter also said, from the Merriam-Webster dictionary, saying that worry is a mental distress or agitation resulting from concern, usually for something impending or anticipated. And the same dictionary defines anxiety also as an abnormal and overwhelming sense of apprehension and fear, often marked by physical signs such as tension, sweating, increased pulse rate, and also marked by doubt concerning the reality and the nature of the threat, and by self-doubt about one's capacity to cope with it. Usually, a low stress or worry is actually good. It's a natural response that we have that will help us to act appropriately. And it also helps us with mental and physical performance by the reaction it produces in our muscular system, the cardiovascular system, and our brain. It helps us improve our performance with a low stress or anxiety. A low stress or anxiety also is very helpful in that it also helps us with increase our creativity. Like you have a project or a paper that is due, you increase, you push yourself past your comfort zone, out of the box, into boosting your creativity as to what else you can do to finish the project. It also helps you with your motivation. When you are having a project or anything to do and you feel stressed, you feel that you cannot do it, the brain is wired such that it helps us strive to do better. It helps us push, find new ways of doing things to be able to achieve that goal. And once we achieve that goal too, we have a sense of accomplishment. We feel a sense of joy that we're able to accomplish it. It also helps increase our brain power, in that when you're under stress, certain hormones are released and chemicals are released in the brain, which help increase your focus and concentration and help you get things done in a shorter period of time because you find ways or means of getting things done in a shorter time than you would have done without it. It also helps with increase your resilience, mental resilience. When you've gone through a period of stress, after the stress period, you feel mentally stronger, that you've been able to go through it. And then when you face a problem again, you're able to have the capacity to go through that problem. Apart from that, little stress and anxiety is also needed to help with, it has a University of Stanford study showed it helps with increasing the function of the the cells that help with immunity. So it boosts your immunity short term. Long term, it does not help. A little stress also helps with, when you encounter situations, prevent injury. It helps you act quickly because the muscles tense up, and like you are walking on the road, as a car coming close by, you have to jump out of the way. The muscles act pretty quickly for you to take this action. Or you are driving and then the car in front of you stops immediately. You slam on the brakes, and this is part of a stress response. What happens in the body is that I'm going to go through what happens in the body when you're under stress, and then you understand why its effect can be negative if it's prolonged. What happens in the body is what we call the stress reaction. It's a survival mechanism that was developed for survival in the ancestors in nature, where you face life-threatening events and you have to act quickly, and this helps you to take care of that. It's called the fight or flight mechanism. And what happens with fight or flight mechanism? The body's natural response. You start feeling your heart racing, you start sweating, your muscles tense up, your breathing quickens. And what happens in the body is a whole lot of physiological response that happens. So what happens is when you see something, the brain, a portion of the brain called amygdala, which is a small portion of at the base of the brain, when it senses from sight and from what it from the sight and from images and from sound, that whatever situation is life-threatening, it immediately sends a signal, a distress signal to the hypothalamus, which acts as the command center. Hypothalamus, when it gets the signal, immediately can activate the autonomic nervous system to affect parts of the body to cause a reaction to occur. The autonomic nervous system deals with involuntary things in the body, like constricting or dilation of blood vessels, your breathing, your blood pressure, your heart rate. So when it's stimulated, when the hypothalamus realizes there's a threat, it stimulates the autonomic nervous system, which has two parts, the sympathetic system and the parasympathetic system. The sympathetic is like the gas pedal in a car. When you press on it, it revs it up. It revs up the reactions of the stress reaction that happens to the heart rate and everything. And the sympathetic system is activated once the hypothalamus senses there's a threat. Once it's stimulated, it sends signals to your adrenal gland, and the adrenal gland immediately pours out a lot of adrenaline and cortisol into your bloodstream. With the release of cortisol and adrenaline in the bloodstream, you start having a fast heartbeat, your blood pressure increases, it starts constricting blood vessels to non-essential organs and sends it to important organs like the heart, the muscles, and the brain for action, because you are preparing for action. Your breathing quickens, you start breathing quickly and deeply. The small airways in the lungs open up so that more oxygen is sent into the body. Once oxygen gets into the body, into the lungs, the blood vessels which are supplying the lungs take this oxygen-rich blood to your muscles, your brain, and the heart. The heart is pumping quickly to take all this oxygen to the muscles because it feels you are in a life-threatening situation where you need to either fight or you flee. It's like when you encounter a bear or something like what was happening when man was living in nature. So these reactions occur. And apart from that, the other reactions that occur in the body, with increased oxygen supply, there's also increased production of glucose from the liver. The brain boosts the brain's use of glucose. And then with the boosting of brain use of glucose, your eyes dilate, so more light comes in for you to see better. Your peripheral vision is improved, so you can see better, to see what's going on in your surroundings. Your hearing is sharpened, so you can hear better. And you are more alert to deal with the situation. And also, you start sweating. Sometimes you have cold, clammy hands and feet because blood is diverted from non-essential organs to the essential ones that are needed, like the muscles, the heart, and the brain. Also increase in clotting factors to prepare you for in case there's an injury. Certain functions are suppressed, like your digestion, your reproductive system, growth and immunity. They are suppressed because more energy needs to be supplied to where it is needed. So these are some of the reactions that occur when you are under a lot of stress. After the stress is over, usually when the stress is over, the parasympathetic system, which is like the brake, the hypothalamus sends information to the parasympathetic system, and it cools things down. Your heart rate goes down, your blood pressure goes down, and also your systems and organs return to a normal function. However, in some people, they are not unable to put their brakes down. So it becomes like a car that's running idly on high all the time and being revved all the time. So it continuously being bombarded with the cortisol and the adrenaline. And when you're bombarded with continuous cortisol and adrenaline, what happens is it damages the blood vessels, It increases your blood pressure all the time. It increases cholesterol and other substances that cause serious health issues in the long term. I don't know whether I can talk more about the other health issues as we go along this effect.
Yeah, this is wonderful. I mean, it's so exciting seeing the whole cascade of things that happen whenever we trigger this stress, this stress, I know they call it syndrome or stress mechanism, gets going. And so the bottom line is that whenever we get this going, we get all this cascade of things going on. I still want to defer back to you and just walk us through, a few of the health conditions that if we don't take off the stress, if we don't take our foot off the pedal, what are some of maybe specific examples, of some of the possible health effects that we can bring on?
Okay. Some of the health problems that happen when you are undergoing such stress, with the increase in adrenaline and cortisol in your blood system, it increases your risk for heart attack and heart disease. That's one of the most common effects of this increase in adrenaline and cortisol. It increases your blood pressure. It increases plaque formation, which is deposition in the blood vessels that cause atherosclerosis, which is diseases of the blood vessels, putting you at risk for stroke with the increased blood pressure. Also, with this stress, most people, when they are stressed too, some people, when they are stressed, tend to eat more, increasing in obesity, which puts at risk for heart disease as well. And some people tend to smoking, which increases your risk for heart disease. And there's actually a syndrome called Takotsubo syndrome, which is also the broken heart syndrome, where severe stress can cause a dysfunction of the lower part of the heart, giving you symptoms like a heart attack, with a chest pain, with what we call EKG, the tracing changes, as well as all the things with weakness of the heart muscles. But it's short-lived. Some people actually can trigger a heart attack and even sudden death with a surge of hormones that occur with this persistent or sudden stress or sudden release of so much hormones. It can lead to that. Other things that occur with this persistent elevation in your cortisol and adrenaline is found to increase the risk of having asthma. There have been studies done in which pregnant women, they were all on the same level as far as exposure to pollution and smoking tobacco. Children in which the mothers were stressed we had a higher tendency of getting asthmatics than compared to the mothers who were not stressed. Also, when you have continuous stress, histamine levels increase. This increases how the bronchioles, which is the tubes in the lungs, they constrict, making asthma worse when you're already an asthmatic. So it makes you prone to asthma. If you're a pregnant woman giving birth to a baby who is more prone to asthma, as well as you yourself, you're an asthmatic, the histamine released makes you more prone to asthmatic episodes. It also increases your risk for diabetes. As I said earlier on, the stress hormone increases glucose production from the liver. With the increased glucose, if you're diabetic already, your blood sugar gets out of control. And if you're not diabetic, it makes you prone to diabetes. And in addition to also, as I said, cortisol increasing, intake of nutrients and all that, people become obese, which increases visceral fat, which is fat around the belly, abdominal fat, which is said to be more dangerous than when you deposit fat in your thighs or your legs. There are more health risks associated with abdominal fat, which is what happens under stress situation. Cortisol, which is released, increases the incidence of abdominal fat. A woman with your waist circumference more than 35 and men more than 40 increases your risk for diabetes and heart attack and heart disease. These are all increased risk with this increase in these hormones. Apart from the increase in diabetes, stress causes your muscles to tense up. With a tensing up of your muscles, increase in body aches, muscle aches, and pains, headache, tension headaches, as well as migraine headaches have been found to increase when you have chronic stress. In addition to that, depression, anxiety, personality disorders all increase with chronic stress. Your gastrointestinal system is affected. The way food goes down is affected when you're under stress. So this leads to symptoms like increased acid production. If you have stomach ulcer, it gets worse. It increases gastritis, increases acid reflux symptoms. Some people have nausea, vomiting, diarrhea, constipation, increase the risk of irritable bowel syndrome. People who have what sometimes constipation, sometimes diarrhea, and this is increased in stress. It also increases the incidence of ulcerative colitis, and also increases other GI, that's gastrointestinal problems. The other things that are increased are the sexual and reproductive system. The sexual desire is decreased in both men and women. With men with chronic stress, there's decrease in testosterone production, which leads to decreased sperm production and erectile dysfunction. In women, what happens with chronic stress, you have more irregular periods, which are more painful and heavier. During menopause, the physical symptoms of menopause are worse. If you have chronic stress, we find those symptoms to be worse. You have problems with skin conditions. Some people lose their hair during periods of chronic stress. You have worsening eczema, psoriasis, acne. Those are other things that would happen. Alzheimer's disease studies have been done, in animal studies have been found that there's increase in severity of Alzheimer's disease and Alzheimer's disease in animals who have been subjected to stress. Increased brain lesions have been found. Increased accelerated aging has been also found with chronic stress. They did a study in which women who were taking care of chronically ill children, their chromosomes were looked at, and certain portions of the chromosome show that aging is increased by 9 to 17 years with chronic stress. So that compared to their age counterparts who are not taking care of chronically ill children, they found to be increased. There was accelerated also death, premature death, taking care of their partners. When they compared to people who are not doing that, had a death rate increased by about 63%. And I've seen that in my practice, that the other spouses in good health but taking care of an ill person, the one who was well end up dying sooner because of the chronic stress. They end up having various illnesses associated with that. So chronic stress, short term is good, as I said, in boost your creativity, motivation, brain power, mental strength. But then long term, it's like you're putting your foot on the pedal all the time. Your system is revved up all the time. No time to relax. It's constantly producing adrenaline, damaging your blood vessels, stroke, heart attack, blood pressure, diabetes, or in fact affects the whole body system. So everything is made worse by stress.
Wow. Thank you so much, Dr. It just doesn't look good. Worrying, stress, anxiety just doesn't look good. It explains why God is emphatic that we shouldn't be anxious, we shouldn't worry. So thank you for helping us to understand that. If you just joined us, you are watching the Fountain of Life podcast, and I'm having a conversation with Dr. Dorothea Addo to look at the medical effect or the health or physical effect of worrying and anxiety on our health. So before I go back to Dr. Addo, if you have any questions or any concerns that you want Dr. Addo to address, you can always send us a message on YouTube or whichever medium you are using to watch this, and we will address it at the tail end of this episode. So I want to get back to you again, Dr. Addo. You've laid it out plain and clear, that this is just not a good thing. Question is, what should we look out for to help us to know that we need to put a break on this worrying? We need to put a break on this anxiety. Is there a safe zone that you can be when it comes to like worrying? Because occasionally we all worry. What should I look out for to know that this is now becoming a problem and it's going to impact my health? Is there any boundaries safe boundaries that we can be in?
Okay. Yes, there are safe boundaries. Usually, I'm going to give you some symptoms of stress and anxiety, which, when it's excessive, causes problems. First, there are emotional symptoms like you feel agitated, frustrated. You tend to be moody. It's when you cannot, you are worrying so much you cannot even quieten your mind down. That becomes a problem. When you avoid people because the worrying and anxiety sometimes can give you low self-esteem, and people tend to avoid other people because they feel lonely and they don't have any confidence in themselves because of the extreme anxiety they are facing. They are worrying all the time. They are agitated. They are frustrated and moody. They avoid people, and that is some of the emotional symptoms. Physically, people feel tired all the time. They have difficulty sleeping, having headache. They have clenching of their jaw, grinding their teeth, dry mouth, difficulty swallowing. They have digestive problems that I've mentioned before, including stomach ulcers, nausea, vomiting. Someone can just present with a nausea, vomiting, and it could just be due to stress, and it may not be any other medical problem going on. They have a decrease in the sexual desire and performance. They have problems with headaches, as I mentioned before, sweaty palms, and all that. And then you go to cognitive symptoms like forgetfulness. They are pessimistic. They are disorientated. Sometimes they are unable to focus. They have poor judgment and make poor decisions. And behaviorally, they have eating problems, like they have either anorexia, where they don't eat at all, or they overeat, leading to obesity, and they have problems with avoiding responsibility. They want to procrastinate things, and there are other physical symptoms. But all this, when it gets overwhelming and the person is always on edge, school or work performance is being affected. They are using alcohol and drugs and tobacco to deal with the stress. That becomes a problem. You need to seek medical attention. When there's changing in eating habits and sleeping patterns that is affecting your lifestyle, yes, it's important you seek medical attention. Then it progresses to irrational fears and anxiety, like even sitting on a public transportation gives you severe anxiety or fear, or certain things which should not give you anxiety or fear brings on anxiety and irrational fear and anxiety. That is a problem. Some people have trouble going through their daily activities. It's so much anxiety that they cannot even do their daily activities and unable to work. They're unable to do anything. They stay at home, keep alone, avoid family and friends. They have withdrawal from them. So if you have somebody who withdraws from the family and friends, it could be anxiety they are going through. They may need help at that time. They have suicidal thoughts, self-mutilation, or desire to harm other people. That becomes a problem. It's important I mention at this point that there's a stigma associated with mental conditions. People find it difficult seeking help, but it's very important they do, because we have different genetic vulnerabilities to anxiety. Some people have genetic deficits or defect in their amygdala, which I mentioned is the emotional processing center in the brain, such that their threshold is placed pretty low. So when images and or sounds which should not provoke a stress response provoke stress response in them, and they may need treatment. And there are various things that makes other people more prone to it. If you've had trauma, childhood trauma, or had trauma in life, like gone through a very difficult divorce or financial difficulty, or had through a natural disaster, or sexual or physical abuse, those are being bullied. Those all put people at risk for anxiety associated with stress. When stress, I gave the definition of anxiety, stress, worry, then I gave a definition of anxiety. So when worry has progressed to anxiety and becomes so overwhelming that it affects your day-to-day life, then it is important you seek medical attention. There are treatments available, both medication and behavioral treatment, and other lifestyle changes which could help deal with this situation. Thank you.
Okay, thank you so much, Dr. Addo. before we go on, I'll just have a quick follow-on question. All these things that you are describing, are they age? Is there any age factor involved? Because we have a generation of young people who have gone through a lot of trauma in the past 2 years because of their disruption to their lives, because of this COVID thing, learning from home, missing prom. You know, if you are on this, watching this episode, and you have young children under your care as a parent or as a custodian, as a guardian, are there any advice that you can give for parents and our young people that, worry and anxiety that they're experiencing now could have long-term effect down the road, and we need to find ways to deal with it? Is there any age-related side to this?
Actually, it is said that most anxiety developed by age 11. If people are going to have anxiety, of those who have been diagnosed with anxiety at age 11, 50% of the people already show signs of anxiety. By age 20, 80% have shown signs of anxiety. So it's usually the younger age group that anxiety is usually seen by 80%. When you see it an older person, you have to look for other medical causes, substances of abuse and other substances they're using, etc. But in the younger people, it usually starts early. They start with even separation anxiety as a child going to school, or separation from the parent. That anxiety starts and it progresses. By age 11, 50% of those diagnosed with anxiety are already diagnosed by age 11. So the symptoms I had mentioned, like withdrawing from family and friends, unable to shut their mind down, excessive worrying, they're frustrated, they're agitated, moody. It could be signs of anxiety. They may be subtle. I do not do pediatrics, but then these are symptoms will be present in the pediatric patients as well. So parents, watch out for things like that. If they find your child withdrawn, complain of headache, nausea, vomiting, they have diarrhea today, they have constipation the next day, they have difficulty sleeping, they find it, they are starting picking up some social behavior, like picking up bad things, like starting on using tobacco and alcohol and drugs. You need to look out. It could be anxiety that is causing all this problem. Anxiety causes a whole host. Actually, said about 70 to 90% of office visits to the primary care doctor or to doctor's visit are anxiety related or due to anxiety. And sometimes even doctors may not diagnose it initially because it's a medical problem, because as you can see, it affects the whole body system. The hormones released and the chemicals affect the whole body system, from headaches to jaw clenching to chest pain, heart rate, blood pressure, and all that. So in a young person, you need to look out for these things. Change in behavior. You may want to think that with all this COVID, staying home, they may be experiencing some anxieties. And it's the 80%, as I said, is found in young people. It starts in a young age. So it's very important we are alert for that and treated immediately so it doesn't progress. As it progresses in life, then it becomes to change to various phobias, and other depression and all that. So it's very important. It's caught early and treated in young people. Thank you.
Thank you so much. And with Dr. Dorothea Addo on the Fountain of Life podcast, as we try to find ways we can escape the anxiety trap by worrying less and caring more. So looking at all that you've told us, it's really, really important facts that you've laid out. And it will seem to me that, like you just mentioned, a lot of the symptoms that we present with at the hospitals are things that derive from, our ability to manage stress and, the effect of stress and all of that. Now, let us begin to turn our attention to what are some of the things that we can do to help ourselves. So, yeah. So what are some of the solutions? What can we do?
Okay, some of the things we can do are actually things we can do ourselves to help with the anxiety. We can first find out what is making you anxious, what is stressing you, what is making you worried, and deal with the issue. The other issue is the other things you can do. There are relaxation techniques that help with deal with anxiety. You're in your office, you're having a panic attack or stress due to a project that is due. Just take time off, just taking deep breaths, and as you breathe out, you try to relax various muscle groups starting from the jaws, the shoulders, and other parts of the body. And as you're breathing out, when it relaxes the body, the stress hormone, the physiological response of the stress response is decreased as you take in deep breath and deep breath out and try to relax. The other ways to deal with this is when you, meditation or prayer. You can, in a parking lot at home, if you're religious or a Christian, you have verses or other things you can meditate on, and using prayer, be able to relax you, because when prayer meditation is said to activate the parasympathetic nervous system, which is the rest and relax. That's what brings everything, cools everything down. Your heart rate goes down, your blood pressure goes down, everything just goes down with that. And that's a very important thing you can do to help you with too. The other thing you can do is reframe the situation. And if you're stuck in public, you're stuck in traffic, what you can do is, instead of being worried about the meeting you are missing, use it as an alone time that you can use to do other things. Or the other thing you can also do is also focus on the moment, instead of, people are worried and stressed because they're thinking about the past regrets or the future, what they're going to do, what they can or cannot do. But if you focus on the moment, you're able to relax better. The other things you can do is, we have found to be very helpful, is exercise. Exercise has been found to be very helpful. Exercise increase endorphins, cannabinoids, as well as dopamine and serotonin. And these are called feel-good hormones, or they make you relax and make you help with your mood and all that. Endorphins are chemicals which are released during exercise, and they are said to be your body's natural pain relievers. They boost your mood, they decrease your pain and discomfort, and they increase pleasure, they decrease stress, depression, and anxiety, and attenuate inflammation, as well as they boost your self-esteem and improve your mood. So exercise, apart from its health benefits in other various health diseases, we encourage you to exercise at least about 30, 40 minutes, 5 days a week. This helps you with weight gain, it helps with diabetes, it helps with your blood pressure, heart risk, and all that. In addition to it, releases the feel-good hormones like the endorphins, which help you by themselves, the hormones itself, help you boost your mood, decrease pain, increase pleasure, decrease stress, depression, anxiety, and all that. There are things you can do to increase your endorphins. Apart from exercise, there are things like to increase your feel-good hormones and chemicals. Apart from exercise, laughter would increase it too. Listening to music, and music therapy has become a big thing in hospitals these days, where there's music, people are trained to use music therapy to increase your pain threshold, and it's being used in hospitals. I know people have been trained to use that. They also have dancing increases your feel-good hormones, and we had mentioned meditation, which also increase your feel-good hormone. Sex does increase your endorphins, dopamine, serotonin, and oxytocin. Oxytocin is something that helps boost your trust, empathy, and decreases your stress. Certain foods like dark chocolates do help too. So these are things that can be done to improve stress. Other things are like a balanced diet. Eating healthy diets, especially increasing the contents of your food of green leafy vegetables, antioxidant, things that are high antioxidants like your broccoli, your kale, the spinach, fruits, the berries, the strawberries, and all that. They all help in improving your well-balanced diet with nuts, salmon, omega-3 fatty acids. They all help in decreasing your stress hormone level. Studies have been done, seeing the magnesium and vitamin B1. So all those help. And magnesium is rich in nuts like the pecans and all that. They all help with decreasing, helping with your stress hormone. Good sleep is good, and something. And if all this doesn't help, then it's time to see your doctor. And when you see your doctor, they can either send you to a therapist for CBT therapy, which is cognitive-based therapy, in which you are made to write down things that a thought that disturb you, and then they give you positive things to also write. That's the same thing we usually do with, helping with scripture or anything to counteract those negative thoughts. So they give you things to do to counteract the negative thoughts you are. And it all fails, then the doctor also can put your medications. There are medications that will help. Do not hesitate seeing your doctor, as I'll emphasize again. See your doctor when you have symptoms you cannot control and you feel you're having those side effects, because it eventually increases your aging and risk of death. So it's very important you do that. Thank you.
Oh, thank you so much, Dr. Addo. And if you just joined us, you're watching the Fountain of Life podcast, and I'm having a conversation with Dr. Dorothea Addo on how to escape the anxiety trap by worrying less and caring more. We are looking at the effect of worry and anxiety and stress on our overall health. So if you just join us, you are welcome to invite somebody to watch with you. And if you have any question, the contact information is scrolling below your screen. And you can always forward any questions to us and I'll direct them to Dr. Addo. Just on the lighter side, Dr. Addo, some people believe that, well, when I'm worried and I'm stressed, I have to bury my head in a bottle of wine or go to the pub and then just just quaff some beers. What do you say to people like this who rather go into, they tend to habits or things that are rather more destructive, than I'll put destructive in quotes.
Exactly.
Yeah. So what can you say to people? Because among the things that you've listed, I will put them more in the bracket of, helpful things. So what can you say to people like that who rather thinks, well, I'll rather do something else?
Yeah. As the saying goes, people will say, I'm going to drink my worries away, or I'm going to stress eating. All those are habits that increases your risk for disease. Apart from the drinking being unhealthy for you, it increases your diabetes, increasing obesity, makes your diabetes worse, it makes your blood pressure worse. And I have patients who come in who drink a lot. Blood pressures are difficult to control when you drink, so it makes your situation worse than better. And it becomes a cycle. As it gets worse, you get more depressed and you drink some more and it gets worse. It also increases stress and anxiety, increases eating. Some people say I'm stress eating, and this increases obesity. Increased obesity increases visceral fat. As we said before, visceral fat is the belly fat. Increased belly fat is unhealthy fat. And that's what the cortisol that is released during stress does. It deposits the fat in your belly, which is the unhealthy area. If it was deposited in the thighs or the legs, it has not found to have any health consequences. Even if you are a normal weight for your height, which is called the body mass index, and you have a big belly, it is still increases your risk for diabetes, heart attack, stroke, and other health issues. So beer, eating, drugs are all detrimental to your health. And it is very important that you see medical attention. So when you realize the person is going that route, using some people, especially teenagers, I have seen teenagers and young adults trying to self-medicate instead of seeing a doctor, self-medicate for anxiety. They are smoking marijuana, now they are having edible marijuana, and they are trying to use that to manage stress. But it has been found that these things, especially in the teenage to young adult, it affects your brain development, it affects your IQ, because your brain is still developing and it's unhelpful, affect executive function, that in being organized and being able to plan and do other things. It affects all that. And also puts you at risk for psychosis. Your first episode to psychosis is 4 to 5 times higher when you use those drugs. So, and they are gateway drugs as well. So it's very important that these are detected and treated early by the doctors. So if you're doing any of those things, drinking and all that, it's better you see your doctor to help you rather than self-medicate. They try to drink away their sorrows with all that, and in turn rather causes problems, more problems than help, and more anxiety sets in because of the problems. Thank you.
Okay, thank you so much. If I got your first name wrong.
That's okay.
Yeah. So thank you so much, Dr. Addo. Let me just stay on the safer side. So in summary, therefore, what will you say to us all on this podcast and people who might watch us later on, in the show, to encourage us to seek help, to not pander to maybe despondency, but to have a positive outlook on life. Because sometimes when we are confronted with some of this initial things, initial stress, I call it we say the white coat effect. People are terrified, of what they will be told or what they are going to see in a scan or something. So we rather tend to shy away from seeking help. In closing, what are your thoughts to help us to deal with the worry of our worries, so that we don't have to, we approach life with confidence, and approach these things with a more positive attitude?
Yeah. What I would advise is, I know people are afraid of seeing the doctor because of what may be said, but it's better and deal with it early than when it's bad. Like if you're having anxiety problems, it's better you deal with it when it's just anxiety, but before you develop the high blood pressure, before you develop the diabetes, before you develop the stroke, before you develop, other ulcerative colitis. And I forgot to even mention that autoimmune diseases are increased with anxiety. Tumor cells are increased with prolonged stress and anxiety because the immunity is decreased during that period of time. So if you see your doctor, they may be able to help you in the early stage. It may not even be medications. It could just be behavioral therapy or seeing a therapist, which will help. But if you do not start at that stage and it persists, then it leads to long-term problems which cause irreparable damage. Stroke can cause irreparable damage. Diabetes can cause irreparable damage, which puts you more at risk for heart disease as well. So it is very important that you seek help early. And if you've done all the other things you said, good health, drinking lots of water, eating healthy, relaxation technique, praying, everything, don't be shy. Don't find it difficult to seek medical help. God uses doctors to help you. So it's very important that you seek help and you treat it early rather than later, which would even cause more stress when you realize that you developed some cancer here, or something like that has happened, or you had a stroke, heart attack, which could have been dealt with in the earlier stages.
Okay. So thank you so much. As we bring this episode to a close, I want to express my sincere gratitude to Dr. Dorothea Addo for volunteering to share her thoughts with you on how stress, anxiety, and worries affect our health. Now we know. So it is up to us to decide what we want to do with our worries. Like the politicians say, the only thing we have to fear is fear itself. So I'll also add my bit to it and say that the only thing we have to worry is our worry itself. So if you're finding yourself constantly worrying, find help, find way to deal with it. God says expressly, we shouldn't be anxious. Says don't be anxious for anything, but in everything, by prayer and supplication, we should let our requests be made known unto God. And the peace of God that surpasses all understanding shall keep our hearts and minds in him. That is Ephesians, Philippians 4, 6, and 7. So on behalf of my production crew, on behalf of all the audience, we want to express our heartfelt gratitude for your time, for your wisdom, for your knowledge, and all that you shared with us in this episode. Before we go, I want to find out if there are any questions that any of our audience wants Dr. Addo to address for us. Is there anything that has come in on any of our platforms so far? Okay, I don't see anything here so far in our chats, but you still have the opportunity to reach out to us. The contact information is scrolling at the bottom of your screen. So thank you so much, everyone. Thank you to the technical team. Thank you to our guests today. It's been a real pleasure connecting with you after all these years, and I really appreciate the opportunity to have you sit with you and then share these wonderful thoughts with us. Thank you so much, and may God richly bless you, Dr. Dorothea Addo.
God richly bless you all too. Thank you for having me. It's been a pleasure, Reverend Zuta. Thank you so
You're
much.
welcome.
Bye-bye.
Bye.
Bye.
I worship you today, Lord, you are. Yes, Lord, fountain of my life. I worship you today. Lord, only you are. Yes, Lord, you restore my soul. I worship you today. Yeah.
The book of Matthew 11:28-29. Come unto me, all ye that labor and are heavy laden, and I will give you rest. Take my yoke upon you and learn of me, for I am meek and lowly in heart, and ye shall find rest unto your souls.